There are just a few steps involved with the CompressAR system to help ensure a successful outcome. These include
patient preparation, placing the CompressAR stand, positioning the point of compression, applying compression, releasing compression. Step 1. Patient preparation.
Before pulling the sheath, first find out if your patient has taken aspirin, Plavix, or any other blood thinners within the last 24 hours. If they have, the hold time may be longer than normal.
Positioning the patient when using the CompressAR is virtually the same as if you were going to hold manual pressure. The patient should be flat on the bed, face up. Ensure the patient's weight is distributed evenly across both buttocks. Step 2. Placing the CompressAR stand on the bed.
Raise the arm to the top of the stand to keep it out of the way when positioning it on the bed.
Rotate the shaft so that the arm is pointed away from the patient during positioning. Unlock the shaft by lifting the top lever. Put the base of the stand underneath the mattress, under the patient's hip. Open the sealed package containing the disposable CompressAR disc and press it onto the arm slide. The discs are pre-sterilized and provided in factory sealed packages. Do not use betadine, peroxide, alcohol, or other solutions on the discs prior to or during use, and do not place anything between the disc and the patient's skin. Step 3. Properly positioning the point of compression. The disc should be positioned over the femoral artery so that when pressure is applied, it partially occludes the vessel proximal to the arteriotomy, slowing the blood flow to permit a clot to form.
Wherever you would place compression using manual pressure is generally where you would apply compression using the CompressAR.
It's helpful to palpate for the artery to locate the point of compression. Position the arm slide and disc over the access site. With the sheath still partially in the artery, lower the arm while twisting the shaft and moving the arm slide so that the disc is placed proximally and medially to the sheath. The body surface should be dry. Firm pressure should not yet be applied. The sheath should be centered in the V-notch when the disc makes contact with the body surface, so that the access site is just outside the perimeter of the disc. When the strong arm is in the correct position, be sure to lock the top lever. To lower the arm, grasp it over the arm lever, tilt up, and press down. Tilting up helps the arm move down smoothly. Step 4. Properly applying compression.
With the compressor disc properly positioned, you're now ready to pull the sheath. Prepare the patient as you would if you were getting ready to hold manual pressure, according to institutional procedure. For anticoagulated patients, the ACT should be 160 or less. Check the patient's distal pulse. This will usually be a pedal or popliteal pulse.
Place your hand over the arm lever and prepare to push down. Then, gently but firmly, pull the sheath and allow a very brief spurt of blood. This should be done in a single smooth motion, which takes about 1 second. Clean away all blood from the area, especially inside the V-notch. There should be no oozing or bleeding at all.
Immediately check the patient's distal pulse. Some protocols require placing compression, which completely occludes the patient's distal pulse. Complete occlusion should not occur for more than 3 minutes. Partial occlusion, where a faint distal pulse is palpated, is recommended as long as there is no oozing or bleeding from the puncture site. Until hemostasis is achieved, visually inspect the site so that any further bleeding or oozing from the puncture site can easily be seen.
Monitor the patient and intervene if necessary as per institutional procedure. Again, there should be no bleeding from the access site once pressure is applied.
Once you have a dry, clean site and a faint distal pulse, there's no need to do anything for a few minutes. You can now finish charting, prepare meds if necessary, or attend to other things in the immediate area. You should not leave a patient unattended while the CompressAR system is being used.
Step 5. Properly releasing compression.
After a few minutes, you're now ready to start gradually releasing compression. The same as with manual pressure, you'll find that each patient is different, and you'll use your skills and experience to determine the right time for each patient, according to institutional guidelines. Gradually release compression in small increments by raising and lowering the arm lever.
This doesn't seem like it releases much compression, but it releases just enough to allow a little more distal blood flow. Always check the site when releasing pressure. Depending on your assessment of the patient, you would generally start releasing compression no later than 3 minutes if the artery has been totally occluded. If the artery was partially occluded, you could start releasing at 5 to 10 minutes. At 5 or 10-minute intervals, compression should then be released in small increments until hemostasis is complete, as long as there is no bleeding. Patients undergoing only angiography who are not anticoagulated will achieve hemostasis within 15 to 30 minutes from the time the sheath is removed.
Patients undergoing angioplasty or stent procedures who have received blood thinning or antiplatelet drugs may require a longer time to achieve hemostasis. The exact amount of time will depend on your assessment of the patient and should be in accordance with facility guidelines. The puncture site should be observed while compression is being released. If any bleeding starts, compression should be immediately increased by pushing gently down on the arm until the bleeding or oozing stops.
To release all compression, gently raise the arm lever to 45 degrees several times until it feels like it's moving freely and you don't see the arm rising anymore. This indicates that all the compression has been released.
After hemostasis is achieved and you've released all the compression from the femoral artery, you can remove the CompressAR. If any cleaning solutions or soaps have been used to wash the CompressAR stand, ensure that any residue is completely rinsed away. Do not use lubrication of any kind on any part of the CompressAR stand. During this training video, we have shown you how to achieve post-cath femoral hemostasis using the CompressAR system, while maximizing comfort for both you and your patient. Please visit our website for more information about the CompressAR system and femoral hemostasis. Thank you for watching.